You're watching Public Affairs. Berkowitz is my name, and politics is our game. And we will be doing lots of politics and public policy. Actually, more of the public policy this evening, because we're blessed to have Neli Vazquez Rowland. She is president of A Safe Haven. You can find out everything you'd want to know by going to asafehaven.org. And, you know, a safe haven, the short of what they do is there are people in need in this state, and they don't help everybody, but they help lots and lots. 5,000 people on average, 5,073 to be exact, last year came through their doors in 1 year. 5,073 people. And why are they in need, and how are they helped? That's what you're going to find out. So Neli Vazquez Rowland, president of A Safe Haven, co-founder with your husband Brian, who deals with the operations day to day. You are the spirit, you are the vision, you are everything that this organization stands for. What are these folks like who come there in need, and what do you do to help them?
Well, thank you for that glowing introduction, Jeff. I am representing really the most amazing team you can ever imagine of people that are really truly committed to the cause. We have over 250 employees, and each and every one of them plays a huge role in helping people transition from their moments of crisis that could have gone on for decades or for a day. At A Safe Haven, what we do is we take people from all walks of life that fall on hard times, whether it's due to a job loss, whether it's due to an addiction, whether it's due to a domestic violence situation or coming out of the criminal justice system. And A Safe Haven is really designed holistically to understand why people are in crisis in the first place. And we're very unique in our ability to really address and simultaneously assess all of the different variables that are involved, such as socially, economically, education-wise, and physically, making sure we find out exactly what's going on, where they're at, and connecting the dots for the right kinds of services sequentially. So obviously everybody needs a roof over their head, right? And they need 3 meals a day. But after that, some may need treatment, some may need education, some need job training, some can go straight to work. And it's a beautiful thing to see people walk in, in a situation where they don't see, a way out, and we are able to really help them navigate that and get back on their feet. At the end of the day, the goal is getting them into their highest level of independence. That it means getting them a job, getting them an income, and getting them into permanent housing.
And these people, they just like wander in, because when I say wander in, you've got, what, 38 locations? Is that right?
We have over 40 real
over
estate
40.
developments.
Okay, and most of them are, excuse me, most of them are housing. So they would be assisted housing or supportive housing, would you call it, affordable housing.
Correct.
The main facility is over at, is it 2750 West Roosevelt Road?
Yes.
So that is 12th in California. The folks, the lawyers who do criminal law know that phrase, 26th and Cal, for 26th in California, because that's where the Cook County Jail is, right? You can drive by there, there's a real jail, there's a big fence, not easy to jump over. And so that's where the jail is, and that's where the main criminal courts are. I would say main criminal courts. It's kind of convenient because a lot of those folks who are going before judges in criminal court are sometimes temporarily, sometimes long time housed at the jail. Sometimes they have not made bail. It's a whole nother matter. But I want to just give you a feel, because when I just say 2750 Roosevelt Road, we are from the Gold Coast to the Soul Coast. We are throughout the city of Chicago. So you could be watching this on the south side, on the west side, on the north side. Some of you folks who are watching this from Hoffman Estates, out of Chicago, or Bartlett, or Rockford, or Aurora, or the North Shore, you may not know what the South Side looks like. You spend a lot of your time at 2750 West Roosevelt, right? Tell us, what's that area like?
Well, the whole issue with the heroin, epidemic and the opiate epidemic, often refers to the highway to heroin. And that means that that is where the epicenter of where much of this activity is happening, whether it's the dealing or the using. And you just described, we're literally blocks away from, and on the same street, as the largest county prison in the country. And
How large is it approximately? Do you know how many, how many are there?
I believe, I'm not gonna say the right number, so I better
Okay.
not. But
Just very large.
it's in the thousands.
Thousands of people.
It's in the
Okay.
thousands of people that are, most of them, I wanna say the last number I saw, maybe 80% of them are there, basically waiting for their court dates. They're in there temporarily, being transitioned, some not making bail,
Right.
things like that. And I wanna say at least 40%, if not more, are there for nonviolent offenses. And that's the population that we work with. But if you were to look at this neighborhood and this community, it's really suffered from decades of, being in despair and not having any investment in terms of business. It's considered a food desert. There's no restaurants. There's no grocery stores. There's no pharmacies. There's no place to really shop.
This is what some might call, excuse me, some might call mean streets. There was a movie like 40 years ago. Was it Robert De Niro, whatever, like Mean Streets. So there's the North Shore, there's Winnetka, there's Glencoe, there's Kenilworth. Life is good. You go out there, there's very little crime. Kids go to school, they learn how to read, they get jobs, they go to college. But they have some addiction issues. We can get on that because that goes across this country.
It does.
They may be safe, they may have less of a reason, less of an excuse for getting addicted, but they suffer from that. But they don't have to worry so much about the basics, a roof over their head. But then you come to your neck of the woods, and that's what you're telling us. Like, is Lawndale around there?
It's North Lawndale.
It's North Lawndale.
North
That is
Lawndale.
North Lawndale.
This
So
is-
people have heard of it. Once a great area. Now there probably are great people there. I've met some. There are great facilities there. But there are also some people who are perhaps gotten off on the wrong side, the housing, crime, drugs, so forth.
Right.
So
there's-
that is the epicenter in a
That's
sense.
the epicenter. I call it ground zero.
But it's ideal for you because you're looking for people in need. You're looking for people to help. They don't have to go far. You don't have to go far, right? They can almost hear of it. Do some of it just hear of it and knock on the door and they come in? Does that happen?
Yeah, it absolutely does. A lot of the growth of
Well, because take me through it. Somebody's knocked on the door. Say somebody got just released from prison or the jailer, okay? And they heard there's a place called a safe haven, and let's say they were accused of a nonviolent crime, just making this up. Drug possession, something like that. But they didn't have much money. They didn't make bail, so they spent some time there. They finally got before a judge. They either had a trial or it was dismissed or something. Okay? They have a rap sheet. They've had some crimes in their background. They've had trouble having a job. They may not have a high school degree. Okay? They come in, they say, I got some problems. Let me tell you, but I want to get good. What do you do?
Oh, well, like I said, everybody that comes through the door at a safe haven is welcome.
Okay, just treat, I'm that guy. I
You're
just
that
knocked,
guy.
I just
You came
I
in,
just told
Jeff.
you,
You
I just
came
told
in,
you what I
Jeff.
told you.
Yep.
Yeah, what are you going to do for me?
And you came in, and the first thing we're going to do is we're going to make you, assign you a case manager,
Okay.
someone that's going to be dedicated to really work with you and help you connect with the different experts that we have on staff. That we're going to find out physically, make sure you're okay. And if
I'm
you're
going
not
to get like a doctor
You're gonna
or
get
somebody,
a nurse practitioner
and
that's
she's
be
going
able
to examine me.
examine you, make sure you don't have diabetes or things that,
Right.
need to be addressed
The major
immediately.
things, right?
The major things. The other thing we're going to do is we're going to assess you to find out, what level of education you have. If you have a college degree, you clearly don't need to do a test or anything like that.
Right.
But if we're not sure, we're going to test you.
I just told you, I didn't
Yeah.
okay,
You didn't finish high
I dropped
school.
out. I
So
was
we're gonna do a tape
10th
test.
grade. How's that? I'm a 10th
We're
grade
going to give you a
dropout.
test. We're going to find out exactly where you're at.
Yeah.
And we're going to assess you work-wise and find out what kind of work history you've had in the past. And what are your interests? And, this is an opportunity to reinvent yourself. So if maybe you were working in a field and you're looking and you were maybe phased out of that field, you were replaced by a computer or technology. So how do we reinvent you in a way that's going to be, giving you access
You can help
to-
me get a high school diploma?
We can give you,
Because that
help
probably
you get
would help.
a GED.
The
yes.
GED? What does
Yeah,
that stand
so,
for? Something equivalent.
general education, equivalent
It's
diploma.
equivalent of, it's equivalent. I can
Yeah.
walk in and say, basically, I have a high school diploma if I complete that program, right?
Yes,
That's a
yes.
big help, right?
That's a big help. And also our job training programs, we're an Illinois College Board accredited institution, so we also provide vocational job training
Right.
certifications in the field of welding, culinary.
I can become an auto mechanic, like welding, I could do home repairs, I can learn lots of stuff. I will
Lots
have a
of stuff.
trade, as they used to say, a trade.
A
Once you have a
trade,
trade, even if you
exactly.
lose your job, you can go to another place and say, here, I can do this, hire me.
Yeah,
And I'm a
which
good
is
guy.
huge scarcity. I mean, right
Right.
now, you know, we've got over 176 employers that actually look for graduates from our vocational job training programs.
They
because
do,
they're
they know
hard
of
to
you,
fill.
and they know of these
Yes.
programs. Do you run
Yes.
them, or you outsource them, or what? These
We
job training programs?
We run some of the job training programs.
Because
but
you
we
actually
also-
have employer, let me just digress for a
Yes.
second. Okay, so while we're talking here, I've been assessed on my health, I've been assessed on my educational background, I've been assessed on my prior job background.
And
I've-
one more assessment
Which
is
is,
the social determinants. So we want to know, are you suffering from some type of behavioral health care challenges and conditions? Do you have a substance abuse issue? Do you have depression? You know, and then we're going to need to address that
I have to
as
tell
well.
you that.
Yeah,
I
we'll do-
have to tell you, okay,
Yes.
like if I'd been fooling around with heroin or
I will
coke,
have to know that. We'll
you
test
have,
you.
I gotta come clean, so to speak.
Exactly.
You're not gonna like take me in and send me back to prison, right?
No,
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 you're not gonna
that's
turn me
not what
in.
we do.
You
no.
wanna know because you wanna help me get off those addictions, right?
Clearly,
Whether
yes.
it's alcohol, substance abuse.
Alcohol.
So
too.
you have trained people there who
Yes.
know how to get this information out because it's hard.
No, I mean, people don't, you know, they feel comfortable. This is an environment where, you know, there's a lot of peer support. There's a lot of people that are there that are suffering from similar conditions. And
It's a safe place.
it's a very safe
That is
place,
why
to
you
be
call it a safe
honest.
haven.
Yes,
Because a
it lives up
haven
to
is,
its name.
here are all these problems we talked about in Lawndale, this is a haven. This is an island of sort of sanity and where people like Nellie or like Mother Teresa. I mean, they just come there, seriously. There's so many of you, I've met a few. So you want to help people. It's like they've not met people before who just want to help you. Okay, so you've got all that information. You said, I've just come clean. I said, I've been fooling around with a little bit of heroin, coke, whatever. Okay, but not much, and I want to get off it. And I've been off it because I've been in jail. So I've been in jail for like 3 months. So I am clean. And I don't want to go back, and you're going to help me, right?
Absolutely.
Okay, so we set it all up, and you have places there, right, you have employers. You actually have businesses at a safe haven, is that right?
So when we started A Safe Haven, we started to do all of these holistic wraparound services for people, but we knew that regardless of all the support systems, we had barriers. We couldn't get them into jobs, and we couldn't get them into permanent housing, because no matter what we did, there's nothing we can do about your background. So we had to create...
And some people don't want me to do a job, even though I'm good, even though I'm saying I'm not going to do anything wrong. They said, sorry, you know, you've been convicted. You have a few...
Right.
They can't always find out. We have this thing banned in the box. I go for an interview, maybe they can't ask, but eventually, if they're interested in hiring me, they can do a background check, right?
Yes, most employers do background checks, and if you show up that you've had a felony or done any time or have an arrest record, you know, that obviously is held against you. So
So
we
what
started...
are you going to counsel me to do to deal with that?
Well, we do have job readiness training, and we teach people how to interview for jobs. But you know, we can again do that all day long. But if the policy is for the employer not to hire with people with those kinds of backgrounds, there's nothing
you can do.
So.
But you don't throw me out, do you?
No. At A Safe Haven, we create businesses. So we
Yeah.
have what they're called today social business enterprises. But, you know, necessity is the mother of invention. So back then, 20 years ago, we really were trying to find ways to create employment opportunities that provided a service so that we can put people to work, get them some job skills, get them a work ethic, teach them financial literacy skills at the same time, and help them get that work experience that they can put on their resume. And now, A Safe Haven owns a catering business, a landscaping company that is pretty famous in Chicago. If you go up and down
Is that
Michigan
right?
Avenue,
What's the name of the
it's
company?
A Safe Haven Landscaping.
A Safe Haven
Yeah, so
Landscape.
you'll
You
see
can
the
see it,
logo
okay.
on our trucks.
Uh-huh.
You know, the medians, the tulips that you see on Michigan Avenue, on Wacker, the rooftop at City Hall even are all contracts of a safe haven. But in addition, we bid a lot of
Landscaping
private work,
contracts, okay.
and also we do snow removal. So that business alone employs hundreds of people every year. It's a beautiful,
They make money.
viable business. Just like any other business, we compete.
It's like a for-profit
Just
business.
like a for-profit business, we compete for business, and by hiring our social enterprises, you're getting not only a really great service, it's an award-winning company in terms of our ability to do high-end projects.
Good to put on your resume.
But it looks good on your resume, but it also is creating jobs for people. So even if you're a business that's looking for a landscaping company, a lot of companies are taking a second look at, not only do they want the service, but, the fact that they're going to spend this money anyway, how can they do a social good and attach to that? So we have a catering business, which I mentioned, and I also have
And that
a
catering
staffing.
business, is somebody interrupted, that catering business, who runs that catering business?
We have actually a chef, who, believe it or not, was an alum almost 10 years ago.
Right.
And he came and he worked under a chef as a sous chef, and the opportunity came up for him to become the lead chef. And
He's like the guy in charge
he's
now.
an Army guy,
He's
had
like
some problems.
It's a feel-good story,
Came
right?
in, he's a success story. We sent him to school. We got him his degrees.
Can you say his
He's,
name?
Well, I could, it's Marshall.
Because I've met him, yeah.
Yeah,
He's
it's
a great
Marshall.
guy.
He's
Marshall's
a great guy.
guy.
We're really proud of him. But he's a great inspiration to all of the cohorts because we train people to work in the culinary arts industry. So his training is very, very intense, and it's very, they serve 1,200 meals a day. So these people are learning, all
Where
the
do they
type of
serve
skills.
those meals?
Safe Haven serves 1,200 meals a day.
Because at your place
The
at 2750, which is your
Headquarters,
headquarters, there are how many beds?
400 beds.
So there are 400 people who get
Yes.
3 meals a day,
Yes.
1,200 meals a day.
1,200 meals a day.
Marshall is
And they're
primarily
all-
responsible for.
They're all healthy, nutritious meals. We give them salads and fruit and vegetables and soups and, everything.
So
made
I
from
come there
scratch.
and you say, Jeff, you can stay here for a little while, not forever. Right here, you're going to have a room, right?
Yes, you're
Do
going
I
to have a
share my room?
semi-private room.
Semi-private room. Cool. Like I just say, okay, I guess I can stay here for a few years, right?
No.
No?
It doesn't happen at ASAP.
How does that, what's
So
going
the
to
average
happen?
length of stay is about 90 days.
Yeah.
And after we do the assessment, what we start to do is design a plan and strategy for your individual case. So the way you described your situation, it meant that you needed treatment. So everything's got to be sequential, right? So the first thing we got to do is we got to get you, first of all, eating well and getting you acclimated to the environment, understanding the rules and conditions you have to live under.
Right.
And then also then connecting you to the treatment services and connecting you to a counselor and a substance abuse
Because I got to
counselor.
get rid of this thing. I might
Yeah,
go
we gotta
back.
get
I'm
you there
clean now, but I
first.
want to stay clean.
Yeah, we got to get you there first. And once we've got you solidly, working on a recovery program, because
Okay.
you are clean,
Right.
but now you have to learn how to live in recovery long term.
You're going to get me
and
good.
that takes time.
Okay.
So after that, we get you into the GED classes. Even the welding program, you have to have a certain level to participate in
Right.
it. So by getting you that GED, the average increase in grades for reading and math at Safe Haven within 6 weeks period of time is about 3 grade levels. So you can
Wow.
come in,
At 10th grade,
at a
I'm-
7th
before
grade
you know
level,
it,
and you leave at a 10th
10th
grade
grade,
level
right, okay.
within 6 weeks.
Within
so it's
6
very
weeks,
intense.
wow.
They're very intense classes. Then after that, we have the ability to connect you to a job training program.
Okay.
And
Because you
we don't
mentioned, let me just
do-
interrupt, because I
Yes.
interrupted you before, I want to make sure we
Yeah.
get it. You mentioned the businesses. You have a landscaping business, right?
Yes.
You have a catering business, right?
Yes,
You have 2 others, right?
we have, the one I really want to mention is the staffing business.
That's right. And before we'll get to that, what's the other one? Then we'll
Pest control.
Pest control, which is important. But the
Yeah.
reason why you want to mention staffing is why?
Because that is the key to getting people back into the workforce and mainstreaming them.
Okay.
As the people that we serve have tremendous barriers to employment, and as employers are really struggling trying to find qualified workers to fill many of these positions, we have the ability to connect job-ready candidates that have been vetted, that have been stabilized, that are ready to work with employers that are looking
These
to
are
hire
folks like
people.
me. I came there and
Yes.
I'm going to get interviewed by your staffing people. They're going to find out again what I can do. And they may say, Jeff, here's a place where you can get a job. We'll send you over there, but we'll prepare you for the interview. Does that staffing business
We'll
only,
prepare you to work.
oh, prepare you to work, does that only deal with people who are from your place internal, or do they go out and get people from outside of Safe Haven
We
as
can
well?
help people outside of the
Okay, yeah,
organization.
you
It's
do,
it's a
okay.
regular
They do
staffing
both, yeah,
business.
okay.
But by
Okay.
the same token, we do orient all of the people that we're bringing into our staffing business and make sure that they pass these tests as well.
So we're up against the clock. We've probably got about 8 minutes, maybe a little less left. And we've kind of covered the essence, have we?
essence,
Because
yes.
I know you want to talk a little bit about the opioid crisis, right? So this is a good time.
Yeah.
Tell us, you got any ideas? What is the opioid problem? Where do you folks fit in? And are you focusing on that now? Have you been focusing on it before? What's going on?
Well, when Safe Haven started back in 1994, it started out with the idea that there was a huge gap in services for people that suffered from substance abuse issues. And we knew that for people that suffered from substance abuse issues, they needed a multidimensional strategy and approach, because if you have an addiction issue, chances are you probably have unstable housing and unstable employment. So unless you deal with the addiction and the other components in an, again, sequential way that's going to lead them to sustainable recovery, independence, and housing, you know, all of them stabilized, you're going to have a really high chance of seeing them relapse. So since 1994, Safe Haven has really been on the tip of the spear. We saw firsthand what was walking in the door, and we were tracking the data to know that there was a disproportionate number of people that were walking in, starting out with pain pills, and that were ending up on heroin.
But you saw that in 1994 when you started?
We saw it in the 90s.
In the 90s, okay.
In the 90s.
You saw
So
that?
We saw that firsthand.
Pain
And
pills,
we were
yeah.
voices in the wilderness on this, because if you go back to the history of the opiate epidemic, you will know that there was a huge movement towards getting people in the doctor's office from the frowny face to the smiley face in the 90s. And with that came the metric that doctors were going to be measured based on their ability to get people from the frowny face to the smiley face. And the pharmaceutical industry started increasing the strength of the pain pills. So we were noticing back again in the 90s, as this was evolving and it was bubbling up beneath the surface, because once people stopped were being taken away the drugs, say for example the pain pills, the next step was heroin. So 80% of the people that we were serving that started out with, you know, legitimate pain pills, you know, ended up moving into the heroin.
How come?
Because of the fact that they weren't either getting the prescriptions anymore prescribed to them, or
the
they
doctors
needed
thought
to.
they were cured, whatever rationale existed,
Whatever
no longer
rationale,
existed,
no
so
longer
the doc
existed.
said, sorry, can't give you any
And
more
it's
pain
very
pills.
expensive. The opiate's very expensive. If you're addicted to drugs, you're probably going to lose your job. You're going to lose your insurance. Right. And heroin started to become cheaper and cheaper and cheaper. And he had the same effect, if not better effect, than the pain pills.
So the people who started out doing nothing illegal, they had like an operation, they had some pain, they thought this was okay, they were addicted, their doc said no more, then they found themselves looking on the street corner to find somebody to sell them heroin?
Unfortunately.
Seriously?
Unfortunately.
So it
That's how
goes
the
like
highway
that.
to heroin started out, because you
The
had all
highway
these
to
people
heroin, okay.
on 290 driving into the
So that is why we got into
neighborhood,
this
yes.
now sort of almost middle class occurrence. We hear in places like New Hampshire and where we thought everything was good, or states like that, Vermont,
Right.
they're in crisis because middle class people, we should worry about everybody, low income, high income, middle income, but we tend sometimes not to worry as much as we should about low income people. But maybe the benefit, if opioids hit low income people and we don't worry, and then they hit middle income people, and those people have a little bit more political sway, well then people start paying attention to this problem. Is that right? Is that kind of what's happening here?
Well, it has
Because we're
always
talking about
happened.
opioids now across the country,
Yeah,
and politicians are talking about
And
it.
even back then, people were asking me, what's the typical demographic that you serve? And I always tell them, and I've always told them, it's not homogenous. You know, people that come to Safe Haven are coming from all walks of life. They end up hitting rock bottom, and that's when they learn about our programs.
But they may have started up and they kind of slid down.
We've got business owners and people that had their own, you know, nurses. You know, there's industries that have a high potential to become addicted because of easy access.
So what is it we do now? We only have a few minutes left.
Okay.
What do you want to do? How can we focus on it? You know this stuff. Tell people. Especially the,
This
look,
is-
you know, it's public affairs. We usually have a politician sitting where you're sitting. So people are wondering, what are you doing, Jeff? Well, you know, sometimes we stumble and we do good. We have somebody like Neli Vazquez Rowland here, and her husband Brian, and a safe haven. You know, even a, what is it? Even a broken clock is right twice a day. You know, so seriously, I fool around with politicians. Who knows what the hell they do of good. But is there some way you could use politicians to help you in general with what you do at a safe haven? And I know you're not political, but they could be useful, or to help you with this opioid crisis. Is there some way we could use, like, because you'll see this on after March 20th, the election probably. So we'll know who the Democratic nominee is for governor. We'll know who the Republican nominee is. We know the current Republican governor, is Bruce Rowland, who comes to your place because you know him. You're not political, but you've known him in the background. Other people come as well, but I know his guy happens to come. It's a good thing. Every Thanksgiving, he and his wife Diana come and serve your residents. So, Bruce, I give you this. Sometimes I've been critical. That is a good thing, right? And you're not getting political because you have Democrats to come too. But my point is, sorry for this long thing, but the question is, so we get that. We have the Democratic nominee, we have the Republican nominee for governor. Would you like to do something with those folks?
Absolutely.
What would you do?
This is the most prominent public health issue happening in our country today. And because we've never really paid attention to it over the last 20 years, the way we are paying attention to it now, it's a lot of extremely important decisions are being made in terms of what are we going to do about it. Just 2 days ago, they showed that the opiate epidemic overdose rate had increased across the country by over 30%. So this isn't going away, it isn't subsiding, it isn't going to, you know, just solve itself. Unfortunately, in Illinois, the surge is even greater. It was over 60% in the state of Illinois. When that number came out, I looked at my own numbers and I saw that within a safe haven, that number has surged over 90%.
What is that, 97? What does that mean?
That means over 90% of the people, so as the population that we were serving, maybe 36% of the people that we were serving suffered from some type of opiate and heroin addiction. Today, that number is closer to like 63%.
Of the people that you
are coming
serve
in.
has gone from 36%
Right.
to 63 who
Right.
have some kind of heroin opioid. So this is like now the central thing for you to look at.
Right, and we are the tip of the spear. So if we're any indication of what's going on out there, you know, we are really asking people, especially elected officials, especially by both sides of the aisle, because this again affects everyone. And I would absolutely love to have a town hall meeting.
Town hall meeting, right?
Yes.
And so whoever the nominee is for the Republican Party, the Democratic Party, you see this, you get in touch with Neli Vazquez Rowland. She is at a safe haven. What's the phone number? Can you give that to him?
It's our phone number at a safe haven. And this is also for people that
No, I got time,
have it.
real quick.
773-435-8300.
One more time?
773-435-8300.
Or you get in touch, go to chicagonow.com/public affairs, my blog. I'll have the information about the show, about Neli, about getting in touch. We'll have the information about July 14th. You've got a 5K run to end homelessness. Join the nation's largest 5K run to end homelessness. Find out more about it by going to asafehaven.org.
Absolutely.
Okay, I think we got it, and you got it because you come back next week and every week to Public Affairs.